You ever stop and wonder, is what we use to protect our teeth actually doing more harm than good? Fluoride toothpaste, alcohol-based mouthwash, we've all been told they're essential, but emerging research suggests they may be affecting more than just your teeth, hormones, your gut, even your brain. And honestly, that's something worth thinking about. Let's start with fluoride. Yes, the same fluoride in most toothpastes. It's supposed to protect your enamel, right? But some studies now suggest it might lower IQ, disrupt hormone balance, even reduce testosterone. Now, this isn't about saying your dentist is wrong. It's about asking better questions. You don't have to take my word for it. Let's look at the data and hear from a few researchers.
I've spoken about fluoride before. It's one of those things that we all think that we need, especially growing up. The dentist tells us to use our fluoride toothpaste, to use all these fluoride mouthwashes, whatever it might be. And they never tell us the other side of the story, that any potential benefit for cutting down on cavities is certainly outweighed by the toxicity of fluoride. And besides, people were doing okay with their teeth before fluoride existed. But we now know there's all sorts of dangers associated with fluoride. There's minor things like skin issues, acne, some skin rashes. Not that that's minor, but that's minor compared to then cardiovascular problems, hardening of the arteries, calcification in those arteries, higher blood pressure, myocardial damage, cardiac insufficiency, and heart failure. The problem with all of these minerals and metals specifically that aren't good for us is the continued exposure, which is never studied. That's always the issue.
And if you're wondering, okay, but what do I do? Don't worry, this isn't about fear. It's about awareness. Here are 5 changes that may help reset your oral health and possibly support your hormones too. Step 1. Breathe through your nose, especially while sleeping. Mouth breathing dries your mouth and feeds bad bacteria. Step 2. Use a tongue scraper every morning. That white coating, it's bacteria, toxins, and dead cells. Scrape it off. Don't swallow it back in.
Can we talk first about tongue scraping?
Tongue scraping stimulates a good bacteria that produces something called nitric oxide. Nitric oxide prevents strokes, heart attacks, de-inflames our bodies. Nitric oxide brings in oxygen, therefore energy, if you will, into our tissues that matter most, our organs, our skin. So arguably it keeps us younger, it keeps our collagen healthy, it makes our organs work better, and it gives us more cellular energy. Tongue scraping increases this bacteria that makes nitric oxide. I found 2 studies on mouthwash showing that it increased high blood pressure almost instantaneously in young people, 20-year-olds.
What?
And I'm like, what? The reason is it diminished nitric oxide like that because it killed the bacteria, the good bacteria.
Step 3. Swap out fluoride toothpaste. I use Knobs tablets or a mix of charcoal and coconut oil. It's simple, and your body may thank you. Step 4. Switch to a boar bristle toothbrush. Plastic brushes can shed microplastics, some of which may mimic estrogen in the body. Not ideal. Step 5. Skip commercial mouthwash. It kills the good bacteria too. Try oil pulling with coconut oil for 10 to 15 minutes instead. It's gentle and surprisingly effective.
Stop using mouthwash. It's a big deal. Here's why. First of all, the obvious. It disrupts your oral bacteria. Yeah, studies show that the bacteria in your mouth actually become resistant, like antibiotic resistance, and they become nastier bacteria that end up where? Down in our gut, causing gut problems. A new study just came out. If you're using conventional mouthwash, it can actually increase blood pressure because it affects something called nitric oxide. This stuff is loaded with chemicals. Obviously, it kills 99.9% of germs. That's why it's a microbiome disruptor. But what about these that are proud of the fluoride in some of these? Right here, anti-cavity fluoride mouthwash. Fluoride is known to be linked to bone cancer in boys. Google it. We don't want to be ingesting fluoride. Are you kidding me? Read the story on how fluoride even ended up as something that we use in our mouth. Because if you read that story, you'll be really ticked off. Look, beware even of natural mouthwash because there's killers in there that still disrupt the microbiome. Absolutely, you do not want to do that. This microbiome, these bacteria are connected to these bacteria, and you don't want to disrupt them. So I don't use any mouthwash ever.
Here's the bigger picture. Your mouth isn't just about fresh breath. It's linked to your hormones, your immune system, even your mental clarity. Maybe it's time we stop treating oral care as an afterthought and start seeing it as a foundation. And as always, I'm not here to claim absolute truths, just to share what I've found and maybe spark a few questions of your own. This isn't medical advice. It's an open conversation because truth evolves, and so should we.